Welcome to Ulosca channel. Access all nursing practice questions. HESI RN maternity and child health practice questions with answers.
Question 1. A postpartum client is experiencing heavy lochia and a boggy uterus. What is the nurse's first action? A. Call the healthcare provider. B. Massage the uterus. C. Administer oxytocin. D. Check the client's vital signs. Which one is the correct answer? The correct answer is B. Massage the uterus. Explanation. A boggy uterus after birth suggests uterine atony, which is the leading cause of postpartum hemorrhage. The nurse's immediate action is to perform fundal massage to stimulate uterine contractions. This helps the uterus to firm up and stop the bleeding before notifying the provider or administering medication. Question 2. A newborn has a respiratory rate of 64 breaths per minute, nasal flaring, and grunting. What should the nurse do first? A. Suction the airway. B. Notify the provider. C. Place the infant under a radiant warmer. D. Initiate oxygen therapy. Which one is the correct answer? The correct answer is D. Initiate oxygen therapy. Explanation. These signs indicate respiratory distress in the newborn. Providing supplemental oxygen improves oxygen saturation and supports breathing. This is a priority before notifying the provider or considering other interventions like warming, which is secondary in this case. Question 3. Which finding in a newborn requires immediate intervention? A. Acrocyanosis. B. Moro reflex. C. Nasal flaring. D. Rooting reflex. Which one is the correct answer? The correct answer is C. Nasal flaring. Explanation. Nasal flaring is a red flag indicating respiratory difficulty. It is a compensatory mechanism in response to inadequate oxygenation. Immediate intervention is necessary to prevent further compromise, unlike acrocyanosis and reflexes which are normal in newborns. Question 4. A pregnant client at 28 weeks gestation has a hemoglobin of 9.2 gdl. What dietary recommendation should the nurse make? A. Increase calcium-rich foods. B. Eat more citrus fruits. C. Increase intake of leafy greens and red meat. D. Drink more water. Which one is the correct answer? The correct answer is C. Increase intake of leafy greens and red meat. Explanation. A hemoglobin level of 9.2 gdl indicates mild anemia, common in pregnancy, due to increased blood volume. Iron-rich foods, such as leafy greens and red meat, help restore hemoglobin levels. Vitamin C from citrus fruits may help iron absorption, but iron intake itself must be prioritized. Question 5. What is a priority assessment in the first hour after delivery? A. Maternal pain level. B. Fundus firmness and location. C. Neonatal reflexes. D. Perinatal hygiene. Which one is the correct answer? The correct answer is B. Fundus firmness and location. Explanation. Monitoring the uterus for firmness and midline position is essential to ensure the uterus is contracting effectively. This helps prevent postpartum hemorrhage. Other assessments are important, but secondary to the life-threatening risk of hemorrhage. Question 6. A child with a history of seizures is prescribed phenytoin. What side effects should the nurse monitor for? A. Gingival hyperplasia. B. Hypotension. C. Tachycardia. D. Blurred vision. Which one is the correct answer? The correct answer is A. Gingival hyperplasia. Explanation. Monitoring the uterus for firmness and midline position is essential to ensure the uterus is contracting effectively. This helps prevent postpartum hemorrhage. Other assessments are important, but secondary to the life-threatening risk of hemorrhage. Question 7. A nurse is caring for a client in labor receiving oxytocin. Which finding requires immediate action? A. Contractions every 3 minutes, lasting 60 seconds. B. Fetal heart rate of 170 BPM. C. Uterine resting tone of 20 millimeters of mercury. D. Late decelerations on the fetal monitor. Which one is the correct answer? The correct answer is D. Late decelerations on the fetal monitor. Explanation. Late decelerations on a fetal heart monitor indicate uteroplacental insufficiency, meaning the fetus is not getting enough oxygen during contractions. This finding requires immediate intervention to prevent fetal hypoxia or acidosis. Question 8. Which immunization is safe to give during pregnancy? A. MMR. B. Varicella. C. DAP. D. HPV. Which one is the correct answer? The correct answer is C. TAP. Explanation. Tetanus, diphtheria, pertussis is recommended during each pregnancy, ideally between 27 and 36 weeks, to protect the newborn from pertussis. Live virus vaccines like MMR and varicella are contraindicated in pregnancy due to potential harm to the fetus. HPV is also not recommended during pregnancy. Question 9. What is the best method to prevent sudden infant death syndrome? A. Place infant on the stomach to sleep. B. Use a soft mattress. C. Co-sleep with the infant. D. Place infant on their back to sleep. Which one is the correct answer? The correct answer is D. Place infant on their back to sleep. Explanation. Placing infants on their backs to sleep significantly reduces the risk of SIDS. This position allows for the safest airflow and reduces the risk of airway obstruction. Soft bedding and co-sleeping increase the risk and are not recommended. Question 10. A 2-year-old is in the clinic for a well-child check. Which behavior is expected for this age? A. Plays cooperatively with others. B. Can hop on one foot. C. Uses 2-word phrases. D. Draws a person with 3 body parts. Which one is the correct answer? The correct answer is C. Uses 2-word phrases. Explanation. At 2 years old, children typically begin to use 2-word phrases to communicate basic ideas and needs. Cooperative play, hopping, and detailed drawing develop later in early childhood, making this a developmentally appropriate milestone.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.